Hello, everyone, and welcome to another episode of Longevanity. I'm just taking a moment here waiting for the streaming software to go live across the board. It looks like we're almost there, so we'll just give it a second. Here we go. Now it's picking up, so that's wonderful, and we can fully begin. So thanks to all of you for joining us today. Today we're going to talk about why your pelvic floor might feel like a saggy trampoline. So please stay with us today as we cover this topic. This affects a number of women at many ages, right from late 20s, early 30s if you've had natural childbirth, and the numbers just keep going up from there. So before we begin, officially, I have to make sure everyone is aware that the content we talk about here is really meant for educational purposes. It is not meant to diagnose, treat, prevent, or cure any disease. And before you undertake any of these procedures or actions, I would always encourage you to talk about your own health with your own healthcare provider who knows you the best before undertaking. So again, just to be on the safe side. So the struggle is real. The saggy trampoline that becomes our pelvic floor. Why is this? So we're going to start with a little bit of anatomy today, and I brought my little friend, the pelvis, here. So I want to talk about this anatomical structure, the pelvis. And so the pelvis, again, from the bottom, looking down from a bird's eye view from above. So basically your pelvis is a bony ring. The spine is at the back. And then again, the pubic bones are the bones you feel at the front. These are the wings of the hips on either side that we all have. And then at the bottom, if you look inside, it's a series of little muscles. And so really the only thing that's keeping the inside of you on the inside of you is this little muscular floor at the bottom. And as that gets weaker, and we're going to talk about all the different things that can happen, things can start to sag or drop down or become very unsupported, and that can cause a host of different problems. So what do we see happening? Well, over lifespan, all kinds of different things can happen. So being pregnant is definitely one of those first challenges to the pelvic floor. So whether you had a C-section or you delivered naturally, if you've had a little human inside you, you've had some stress to your pelvis. So even in the case where we've done a C-section and the baby has been removed through the abdomen versus coming down the normal route, this just carrying of the baby creates stress on the pelvic floor. So when that happens, you've got the weight of this little fetus that's growing and developing, plus all that amniotic fluid, plus the placenta bearing down with extra weight. And again, the only thing that stands between that baby and the outside world is the containment that's provided by the pelvic floor. So over the 9 months of pregnancy, there's again stress on those little muscles. The other thing that happens as you're preparing to deliver, and again, this is just natural. It doesn't matter if you're going to be delivering by C-section or if you're delivering naturally. There are little joints. So for example, there is a joint at the front of the pelvis in the pubic bone. There are these joints, if you see them here, between where this tailbone and sacrum area fuses with sort of what we would call the wing of the hip. So again, there's joints in here. And in order for the body to prepare to pass a little football through this tiny little space, the ligaments have to soften. So if you've ever had a pregnancy, regardless of how you delivered, I don't know if you remember things feeling loose or disconnected or wobbly through your hips and pelvis, but if you did, that was Mother Nature's way of trying to make sure that the rigid, bony ring could actually accommodate the size of the little baby skull that was going to come through. So this is, of course, an evolutionary advantage that allows humans to safely deliver. Because again, if we couldn't do that and we have a baby that's too big to come down, especially in earlier ancient ancestral times, there were no C-sections, those moms and those babies died. So again, to be able to have these processes happen are things that have allowed our species to evolve and be existence present day. But with them, again, comes structural changes. So there's structural changes to the bony pelvis, there's structural change and pressure and weight bearing to the muscles at the bottom as well. So all of these things can cause changes over time. Then again, looking at what can happen, if we again go back to our little anatomy here, the muscular floor is set up again with certain points for things to kind of perforate through. So this posterior opening, posterior because it's closer to the spine, this is where the rectum comes through the muscular floor. More anteriorly, this is the pubic bone at the front, we see where the vaginal canal would come through here, and then of course the urethra in front of it, where the bladder empties. So this little region here in a woman who is not delivering is very small. Again, my little analogy is pushing a football through a garden hose. So this area, this muscular part, again, has to be able to accommodate this incredible change in diameter to allow this little human being to come out. So in the process, frequently there can be tearing to the muscles in the floor because, as you can imagine, again, it's a football in a little garden hose. So things can get torn, and then after delivery, things don't quite sit in the same place, same way. So again, whether you've had a natural delivery, again, via the vagina, or you had a delivery by C-section, in either situation, you've had this baby growing, developing, and bearing down, putting pressure there as the baby is continuing to grow. And then for those who delivered naturally, compounding that, we've now passed this little human out. So again, if you've had a human in your body, there will be changes most likely to your pelvic floor. Now, for all women, those who have carried a baby and those who have families through other ways, or again, have not had children, there's still stress and strain. We live on a planet with gravity. And so again, gravity every day is bringing all of those organs down, and they are weighing on that trampoline. It's getting lax. It's having trouble maintaining its strength and its integrity. Throw in there a little bit of perimenopause or menopause on top of that. With the reduction in those hormones, we often see the pelvic floor get challenged again further. So where there may have already been some weakness already, whether it was from pregnancy with or without a vaginal delivery, when we lose hormones, it compounds this. And so again, we see an uptick in the number of women who have trouble maintaining continence, or again, maybe even developing prolapse, where the inside world is starting to try to descend down through the openings into the outside world. So that's where the internal organs can start to drop or be a prolapse. So again, another uptick. And then again, further in life, as we continue to walk on this planet, by the time we get into our 70s and 80s, there's just other processes that combine and kind of conspire against us to reduce some of our muscle mass and muscle bulk, and we see further thinning out of the pelvis. So what does this mean in real numbers? Interesting theory. We talked about anatomy, but what does that mean to you or the ones around you love? Well, statistically, it's the easy numbers are about 30% of women by 30 have some degree of stress urinary incontinence. And these are the cases that I would mostly kind of blame on or attribute to being pregnant, carrying that little baby throughout development, and or having a vaginal delivery. By 50s, it's around 50%, because to that first 30%, now layer on extra difficulty with the hormone issue. So yay, we recruit another group of women. We're now at 50% of women in the 50s have some degree of stress urinary incontinence. And then add frailty in there. By 70, it's getting close to 70%. So this is not the minority. This is not a handful of people. This is most women. So in our lifetime, most women may struggle with this, and so often it's just considered to be so normal. Oh, everybody gets that after childbirth. Well, just because it happens doesn't mean it has to be accepted. Just because it's natural doesn't necessarily mean good for you or pleasant for you. So I'll give you a crazy example. Death is natural. And again, it's something we actively work to try to put off in medicine. So again, natural doesn't necessarily mean enjoyable or pleasant. It just means commonly occurring. So we don't have to sit there and just accept these changes. There are things we can do. So what can we do? So some very basic, simple things. If you're at home, if you haven't heard of what a kegel is, or kegel exercise, it's where you try to contract your pelvic floor. So you squeeze it down there and again try to build that up, because the analogy is the trampoline becomes saggy, torn, or damaged or thinned out. So these are all muscles, and muscles, like muscles in your body, can respond to exercise. So doing kegels is a form of exercise to try to enhance and strengthen the pelvic floor. Now, it takes thousands of kegels to rebuild a pelvic floor. So, kind of going, oh, there's one, oh, there's another, that can take a really long time. And quite frankly, most people after about a dozen are kind of like, okay, next thing, can't do this anymore. So we have other ways to try to strengthen the pelvic floor. So another way to do that is to induce exercise using something called pulsed electromagnetic energy, or PEMF. And what this is it's using energy. Actually, it's magnetic energy. So similar to having an MRI, it is measured, like the power in these, it's a chair that emits this. The power is measured, actually, the units of measure are Tesla, kind of like the name of the car, but it's actually the strength of the magnets in the chair. And the magnetic energy induces current flow. Now, I don't know how many of you out there have like leftover PTSD from doing physics in high school, but if you ever learned about Faraday's law, do you remember that? And there was like this left-handed rule where the direction of the current and the field and then the flow of the electrons. So anyways, long story short, without trying to give you too much physics, Faraday's law is where we take electromagnetic energy, we convert it into current flow. And this is what discharges the signal to the muscles to make the muscles contract of the pelvic floor. So this does not require thought. You just sit there, and then these chairs can actually do this for you. So in the range of like 11 to 13,000 kegels per half hour. And what's kind of nice about them is that they're not invasive. It's not like having a pap test. Nothing goes inside. In fact, you're actually completely clothed. So for those of you who feel a little modest with these sorts of things, it's a pleasant way to kind of have this done. The way to describe it, how it feels, weird. That would be, I know that's not a very technical term. It's strange, especially the first couple of minutes of getting used to it. It's not what I would call painful. And I have the vast majority of my patients would not call it painful either. It's just weird. And at the beginning, it's kind of like, I don't know if I can do a half hour of this. But within about, 3 to 5 minutes, it's almost like white noise. It's kind of like barely noticeable, and you can kind of carry on a conversation or have a cup of tea while your pelvic floor is doing a massive number of kegels. And so again, if we take a look at why and how, so again, here is the other side, the bottom. This is sort of looking bottom up. I call this gynecologist view. I call this a top-down general surgeon view. But if you're looking at it, the magnet basically sits, the magnet is about this size. And if I can do it to scale, again, the pelvic floor sits on the magnet, and that recruits those little muscles to try to get them all squeezing away. And so as they do that, it's like having a massive, massive workout of your pelvic floor. So a few things to know. This is very similar philosophically to going to the gym. When you go to the gym to exercise, you build up strength. If you continue to go to the gym periodically on whatever that frequency happens to be for you, you maintain that strength. If you stop going, then that strength is slowly lost. So these sorts of treatments are highly preventative, and they work in a very similar fashion. They help to build strength up that you've already lost. These problems can become much better. But similar to this whole premise of exercising, they are things you need to maintain. So what does that mean in the real world? Most women, once they get their pelvic floor strong, they do an initial series of them where they come repeatedly in a shorter course, then often go on to doing a single treatment, maybe as close together as maybe about every 2 months, to spread out as far as maybe every 4 to 6 months. So it's something that you don't have to do super regularly. It is not particularly invasive in your time, but it is something that requires ongoing maintenance. And it's not just for incontinence. Some of the other positive things, there's other things that happen with pulsed electromagnetic energy. Another very large thing that happens is actually that the energy through a cascade of sort of biochemical reactions ends up resulting in the production of something called nitrous oxide. And nitric oxide actually creates vasodilation, or opening of the blood vessels, which improves circulation. So for individuals who struggle with chronic pelvic pain or inflammatory problems in the pelvis, they may struggle with the pain of endometriosis or very painful periods or other inflammatory induced pain in the pelvis. They sometimes find their pain experience is significantly better. We can also use these devices in other painful things. Sometimes we can treat some low back pain with it. Again, it helps with the inflammatory component. So it helps to reduce the symptoms of the pain. So it has some very interesting natural roles that way. So it's kind of a fun sort of program to be in. It's effective, preventative, quite natural. For me, it ticks all the right boxes. And at the end of the day, it changes quality of life. I watch on TV the commercials for some of the different women's incontinence products, and more recently also for men too. And they present these, let's just say, black diapers as if they were silky lingerie. Now, don't get me wrong. This is not something, it's a health issue. It's not something I want people to feel self-conscious about. It happens and we can work with it. But I want you to imagine the models they have on there who are smiling on camera and going out and doing things like the women with their girlfriends. Midlife with hormone changes and growing up with kids sometimes comes with some pretty challenging social dynamic things. The word midlife crisis didn't come out of the blue, out of nowhere. It's a time of big transition. And sometimes that transition involves some partner recycling, where again, people go through life changes and they get separated, they divorce and start dating. In our environment here, where we're chatting privately with women, having to wear even a black incontinence brief is not something that makes them feel confident when they're going out on a romantic encounter where they think that that might be something that would be visible. So again, for people where they can have that confidence and it doesn't matter, that is so wonderful. But if someone is not in that situation and they're not feeling comfortable, we certainly don't want to shame them for the fact that they don't feel comfortable about that. And we do want to provide them with options, actually, other than just accepting it and using an incontinence brief, being able to do something about it where they don't even need the brief in the first place. So this is really about empowerment and options. So if you're using a brief or not using a brief, that is not the issue. The issue is about having you feel the best you can feel and confident in the way that you want to feel confident. So that's what this is. It's about giving choice. It's about giving empowerment. So again, I think some of those ads are a little bit misleading and don't necessarily represent the real reality of some of the individuals that I sit across from and talk to day to day. So if this is something that is applicable to you and you want to explore things that you can do about it, I would be very happy to have this conversation with you. There are a couple of different ways to get in touch with us here. The first thing, I have some information about the chair just on my website. So again, if you have a smartphone, there should be a little QR code right there. If you scan that QR, that will bring you over to our website. We have a whole area just on the chair that we have here and some of the wonderful things it can do. Also, if you're going through some hormone changes and you're not really sure where to start, you're not ready for an appointment, or you know somebody who's going through it and they're not there yet, I also recently put together some patient advocacy materials in the form of a book. It's not like a textbook. It reads more like a story that you'd have across the kitchen table with a cup of tea with your girlfriend. So again, there's a lot of advocacy tools in there, direction and things that we can do to try to help people. But it's on Amazon. Again, I have another little QR code there for you. This will bring you there. There's an ebook if you like your Kindle or your e-reader. There's also, if you're an old school kind of gal like me and you like your paper, the paper is there as well. Within the book, there is a workbook with all kinds of self-reflection and other tools that people can use. So even if you don't buy the book, if you look at the preview on Amazon, you can actually access the QR code for the workbook and you can just start there, and there's no cost involved with that at all. So hopefully that will be helpful. And the other thing is, if you enjoyed this content, we're going to try to be more regular now, getting some educational content out there and trying to touch on topics that are relevant and matter to you. I'd love to know more about what you want to hear about. So this is our little code here again. If you're QRing away, there's a code there to subscribe and follow us here on Longevanity. And reach out to me. I would love to hear from you, and I'd love to design some content about questions and issues that are relevant. So with all of that said, I just want to thank you all again for watching today. That brings us to the end of our episode, and I'm looking forward to seeing you next week with the next episode. Until then, stay well, and remember, last thing, today's educational component was designed to be that and that alone, which is education. It's not intended to be medical device. It does not advice. We are not here to diagnose, prevent, cure, or prevent disease. We are here to empower and educate and stimulate questions and conversation. So I look forward to seeing you next time. Thank you so much for being part of this show.